I'm Aenone Harper Machin, consultant plastic surgeon, and I'm joined by my colleague here today.
Miss Parneet Gill, and I'm also a consultant plastic surgeon.
And welcome to the Grange Clinic Edit podcast. So today we are going to talk everything labiaplasty.
Yep.
So not commonly talked about, not seen a lot on social media because of the sensitive nature of the photographs and things, but something that a woman can truly do for themselves to, I think, improve their overall confidence, comfort. It's surgery that I feel has one of the highest satisfaction rates of any of the operations that I actually do perform. And it's sought out, but not talked about really.
I think that's the problem, because a lot of the time, the patients that want to have something done are very embarrassed. So, they don't really know whether they should be asking for help, and then if they do want to ask for help, they don't know who to speak to.
Sure.
So a lot of the time, the patients will come in there, they've had these problems for years, but have just got on with it. And it's not just a cosmetic thing. It may be, often they say it's very uncomfortable. They can get a lot of rubbing, so it can cause infections. A lot of the time, patients are very conscious about the kind of clothes that they wear. So now everyone wears very tight gym clothes. A lot of patients say they can't really wear the tight leggings, tight jeans, bikinis. So all of that makes them very, very self-conscious. And they want to have something done about it. So the fact that we're talking about it is great.
Yep.
So increasing the awareness of it is an issue, and it can be addressed. So
yeah, I have ladies come and they can be in tears because they have suffered for some time with tissue that has been uncomfortable. They can't tuck away anymore. Sometimes it interferes completely with their jobs. I've done several ballerinas that are professional dancers who've been unable to wear their uniform for work because of excess tissue poking through and having to be taped up. And sports people, cyclists, who find it very uncomfortable after long periods of time in the cycling saddle to have excess tissue that's pinching and rubbing, and again, unable to wear kind of cycling shorts and stuff without feeling quite uncomfortable. So we've talked about the reasons why people might want to have it, but what does the surgery actually involve? So you've plucked up the courage to come and see a plastic surgeon, because that's who you should come and see, board certified plastic surgeon. And you've talked about your discomforts and things. So what are we going to do for them?
So, we do obviously have to do a full examination. It's all done very
sensitively,
but it is a sensitive subject. At the end of the day, we're females, we understand.
We get it.
So it's done very respectfully, but we do obviously have to examine you down there to make a objective assessment of what it is that needs to be dealt with, really.
And that's very often done with a chaperone.
It has to be a chaperone,
so even though we're female and we will be examining females, we have a chaperone with us, and that's to ensure that everybody is comfortable with the examination that's occurring, so that you're comfortable, you feel safe, and looked
very
after.
Important. Yeah. And also not judged as well.
Absolutely.
So I think a lot of the time, patients are almost apologetic about coming to see us about this. And, if it is an issue, we can actually help improve it, then great, but we're not going to be judging you, and it's about being very objective in the assessment. And, we also take photographs for you, just your medical records. So all of that is done, from a health point of view. They won't be shared anywhere. But it is very important to have almost the before and after. And what I found actually is that patients really do like to see what it was like before and after. Yeah. So even though it's quite embarrassing to have your photo done, once you've had the procedure done, it's so rewarding to see the patient's face. Oh my God, that's a massive improvement. You can see it straight away.
And so whenever I examine someone, I'm looking for the length of their labia minora. So if we explain the anatomy a little bit, your labia minora are your inner lips that should be really tucked in behind your labia majora, or the outer lips of the external vagina.
That's where you get your hair growth.
So
the hairy part is the
outer
part,
bit, the labia majora. The inner part is that wrinkly tissue that should be tucked away inside the majora. If those are protruding and over long, that's where you get the chafing and the pinching and having to tuck it away, or even interference with intercourse, having to move it out of the way when you're having intercourse or sexual activity. And so I look at that, I assess that, and there is no anatomical norm of it.
There is no normal. It's all arranged.
Nobody has defined that.
There's no perfect labia majora minora. You have drawings in textbooks, so even the drawings are different to each other in different textbooks. So there's no,
And so really, it's if it is causing you physical symptoms and a problem, then, and the tissue is coming out beyond your labia majora, then you are probably suitable for a labiaplasty surgery.
And we also get a lot of patients who have had babies. So, before they had children, they were pretty happy with how things looked down below. But after having a few children, things do change. Things get a little bit looser. And, that's the other sort of group of patients that we get, once they've finished their family, that actually they're ready to have a little bit of tightening down there and make themselves a bit less self-conscious. Because, like you mentioned, in terms of sexual partners, and, that is a really big issue, where they get really conscious.
Childbirth injury as well.
Yeah.
So a lot of scarring, a lot of purposeful scars to release the birth canal for childbirth can cause a lot of problems down there, which can be corrected with this type of surgery. And then from my point of view, I see a cohort of ladies that are, 40s and beyond.
So how do they present differently then?
So they lose volume in their labia majora. And so by effect of that, their minora become more protuberant, i.e. they come to the outside.
So it's all relative. So it's almost like deflation of the outside.
Deflation of the outside means the inner bit comes to the outside then and is no longer protected by the majora.
Right.
So you can discuss, and we'll discuss various treatment options for those ladies. But surgery can play a role for sure. I think the oldest lady that I have operated on was on her mid-50s.
Okay.
So it is sought out, and she wished she'd had it done, 20 years prior. But there we are. So it's young women, women after childbirth, older women, perimenopause, menopausal women. It's basically, if you have this problem, it can be for everybody. So we've done our assessment. We are going to go for some surgery. What technique do you deploy? What do you do?
So I do all under local anaesthetic as a day case procedure, which we both do.
Mostly same, yeah.
So there's different ways of doing labiaplasties. So you can do a wedge technique where as it explains, a wedge of tissue is removed from the central portion. Sometimes it can, it depends on where the fullness is. You remove that bit of wedge and then you close up the labia minora with some sutures. Or you can do the frill technique. So the trim technique, which is basically, I do most of mine with the trim, to be honest.
I'm a trim only girl. Pretty much. Yeah.
It's just so great. Yeah. I mean, the good thing about the trim technique is basically where the bit that sticks out, you're literally trimming it down.
Yeah.
Easy as that, what it says on the tin. So you're trimming it down and you're stitching it up. But it does allow you to sort of tweak things. So, often it's not just a single, sticky out bit. You may have a little bit of heaviness at the higher bit. It may be a bit fuller in the middle. It may be more loose at the back. So, we get a lot of variety in terms of what's excess tissue that needs to be removed. So with the trim technique, it's very safe.
Yeah.
Lower risk of having complications in terms of blood supply issues. It allows you to really tweak the irregularities and actually symmetrize everything very nicely.
Yeah.
It's very controlled, and we can do it fairly quickly, isn't it? It doesn't take long.
No.
But it has a really high impact.
Tailored, as it were, to that person's anatomy, because sometimes even between the labia minora in the same woman, there is differences to how it attaches at the clitoral hood side. Lower down as it attaches down into the what's called your perineum, so the bit between your vaginal opening and your bottom, and everybody's a little bit different, and even there's differences between labia, and so I find the trim technique is entirely tailorable to that woman's unique anatomy.
You
Even
can
if it's
extend it as
unique.
well.
Yeah, you know,
So
if you have little
once,
skin tags going down in towards the anus or the bottom area, that type of thing. So for me personally, I'm a trim girl, and I know wedge is a reasonable option for some patients, but for the most part, that's what
trim is
what I
away.
would tend to do. Yeah.
But I mean, from a patient's point of view, obviously you're not going to be asking, is it trim technique or wedge technique? You're going to want to know, okay, what's going to happen afterwards. So once we've done the stitching, so normally we have some dressings down there as well. We give some cycling shorts for a little bit of comfort and a bit of a pad just to catch any little drip. And what do you normally ask? Sort of, what's your post-op regime with the patients?
I say to them to have a bottle of water handy when beside the toilet. So whenever you pass urine, that you're just pouring down there the first couple of times, because that prevents stinging. I allow showering from the get-go. So you wash and shower as normal. If you've had a bowel movement, either to use a damp sort of toilet tissue wipes or hop in the shower after you've had a bowel movement. And then to apply Vaseline down there a few times a day. Cool packs are handy, but not necessary. And I try and get them to wear the compression shorts for at least a week or so, just to press everything up.
Shorts or Spanx. I think everyone's got a pair of Spanx nowadays, haven't
handy,
they?
Yeah.
And I think we both use glue as well, don't we?
We do, a waterproof glue.
So
it looks like a little shiny coating over. But other than that, there's no real dressings. You're able to pass urine, have a bowel movement, wash in the shower as you would do normally. And
just take it easy. So a lot of patients just want to get back to their sort of work, gym schedule straight away. But, you know, you have to really take it easy. So what we normally say is no sexy time or gym time for 4 to 6 weeks.
I say no penetrative activities, darling. No penetrative activities.
Now we're getting personal.
Tampons.
You can hold hands.
You know, exactly.
But so you want to have a bit of a break down there and just allow everything to heal with minimal risk of infection. So including gym as well. So, you know, we say 4 to 6 weeks. Ideally, the longer the better.
Spin class cycling.
Because it is going to be swollen. It is going to be uncomfortable. It is going to be, you know, you're not going to want to be doing anything active, but everyone wants to get back to it straight away.
But my ladies mostly would take some simple painkillers for about 3-4 days afterwards, and then just as needed. So discomfort-wise, you know you've had something done for at least a week, but then it just gets more and more comfortable. But if you overexert, then you are going to feel it, you know.
And you're going to need time off work as well. So we have patients who want to go back to work straight away, and actually you need to have a bit of a break. You know, you need to just let yourself heal, because the last thing you want is any complications or wounds.
Okay, so what complications might you see with labiaplasty surgery then?
So with any kind of surgery, there's usual things like bleeding, infection, scarring. Specifically with labiaplasty, the wound can open up. So that's called wound dehiscence. You can get a bit of asymmetry, but obviously we try and match things up as nicely as possible. You can get a hematoma, so that's a blood collection which can be very uncomfortable and needs to be released. You can get a little bit of sensitivity around the scar with a little bit of numbness potentially. The way I know we both do the same thing, we do minimal clitoral hood excision. So what that basically means is we're trying to minimize the risk of damage to the nerves around that area, the nerves which are involved in sexual arousal and you know, so we're trying to minimize messing with those nerves. So we try and keep everything as conservative as possible, but at the same time trying to remove enough tissue to give you a good result. So that's the most common stuff. Pain, but you know, pain settles down. And then obviously over time, when if you go through hormonal changes, the quality and texture of the skin can change as well. So you can get loss of volume over time. Which leads me to the question you kind of mentioned earlier on in sort of the old, I don't want to say older, the more mature cohort of patients that we get. They sometimes come with the labia majora being a little bit sort of deflated. So other than surgery, is there anything else that they can be offered?
Absolutely. And this is kind of an area that, again, is underexplored by women, just because I think they don't know that there's something out there for them.
Right.
So yes, as we age, all tissues in the human body can deflate, lose volume, and particularly for the female genitalia with perimenopause and menopause, the hormonal input to that area, as it becomes less, it affects the skin, the tissues, and the mucosa, so the lining going up towards the vaginal entrance. And so augmenting those tissues can be very, very helpful, both for comfort and also lubrication as well. So there are hyaluronic acid products.
So the same stuff we put in lips?
In lips and faces.
Yeah.
So it is a hyaluronic acid product. So it's a naturally found product in the body. It's used most commonly as facial fillers, volumization for lips, mid-face, and that type of thing.
Yeah.
But there's actually a product called Deserial, which comes as Deserial and Deserial Plus. So Deserial itself is used as a mucosal conditioner.
Okay, so for hydration?
For hydration. Right. So it's actually injected into the mucosa or the lubricating part around the vaginal entrance in order to increase the tissue quality and lubrication in that area. And also itching, discomfort with dryness, all those sorts of kind of perimenopausal symptoms that people don't really like to talk about because they're like, why am I scratching down there? And it's because you've lost that hormonal input to the mucosa and it itches. If you import sort of something that's going to add collagen enhancement and improve lubrication, you get less itching. And then the Deserial Plus is used for volume loss or deflation of your labia majora. So if you have with perimenopause, menopause, notice that your majora is now looking basically wrinkly or a bit deflated, flat. You can feel your pubic bone or your ischium, so the actual pelvic bones that make up your pelvic girdle. If you can feel that when you're sitting and it's uncomfortable, or your labia minora are coming out beyond that, you can augment that volume with a hyaluronic acid product.
And how often do you have to get that done?
So that lasts a good 2 years.
Okay.
It's a very high density hyaluronic acid, very high rheology. So you inject it and it lasts. Okay. So it's not something that needs to be repeated on a frequent basis.
Okay.
And you can have it. And it can be a bit of a game changer for some of these ladies, you know, because it's non-surgical, it's done in the clinic room. And again, some local anesthetic is injected to make it comfortable. And the results are really rather fabulous. Not that we can show you any online, but yeah.
Can I ask you about something else as well? Nice, so obviously all of this, I'm sure you've heard about Ozempic face.
Yes.
There's Ozempic down below as well.
Ozempic vulva. Ozempic, call it what it is, dude. Call it what it is. It's like,
so Ozempic vulva. I keep hearing more and more about, it pops up on my intel. People talk about, there's stuff in the paper recently, wasn't there? So it is a thing.
So with weight loss, again, it's volume depletion. So those compartments of fat within the labia majora, as they deplete with weight loss, people can become uncomfortable down below. And if you're finding that you have lost so much weight, really, that actually you can now feel uncomfortable when you're doing exercise or that type of thing, then replacing that volume can be quite
so you can
useful.
Still use it for the same issues.
Same issues. Yeah. That, and if you want a kind of hybrid between surgical and non-surgical, then fat can be injected in the same area. So it has a very similar effect of volume replacement, stem cell regeneration, that type of thing. But you do need a surgical procedure to harvest the fat.
So it's more extensive, isn't it? And it's
that would be a more invasive kind of way of volume replacement down there. But it can be very effective. So lots of different ways of addressing volume loss in the external genitalia, and something that a lot more people should kind of probably explore and consider, really. So,
and I guess just talking about the fact that there are options for these kind of issues. A lot of the time patients don't know they can get something done about it. But the fact is you can, if it's affecting you.
Yeah.
So, you know, with labiaplasty, it's such a rewarding procedure.
It really
and
is.
actually the patients have been so thankful, isn't it? Straight away they can see an improvement. So so I think overall it's actually really good.
Do you know what, for a plastic surgeon, from my point of view, the satisfaction rate in ladies who have been so uncomfortable for so long, every time people come in, whether they be in their mid-20s to my older patients, they've all gone, gosh, I wish I'd had this done earlier.
Yeah, well, you know now.
It's like,
we can do something about it now. So hopefully that's given a few, you know, answers to those embarrassing questions that you may have had about labiaplasty and any, you know, excess down below. If you're not sure, it's always best to be, you know, to see one of the plastic surgeons to be assessed, and then we can always tell you if anything can be done. But if you have any further questions, obviously put it down in the comments and we will hopefully be able to answer them for you. But other than that, I think we can probably round up our session today on labiaplasty.
Everything labiaplasty.
All right.
See you next time on the Grange Clinic Edit.